Crohn's disease, chronic inflammatory bowel disease that affects the lining of the digestive tract. Causes, immune system. It's possible that a virus or bacteria may trigger Crohn's disease. When your immune system tries to fight off the invading microorganism, an abnormal immune response causes the immune system to attack the cells in the digestive tract. Heredity. Crohn's is more common in people who have family members with the disease, so genes may play a role in making people more susceptible. However, in most cases, people with Crohn's disease don't have a family history of the disease. So who's at risk? People who are below the age of 30, whites and Eastern Europeans, smoking, and people who live in urban areas or industrialized countries. So Crohn's disease is not treatable, but medications, surgery, and self-care can help reduce the progression of the disease. Crohn's disease cells cycle faster than normal cells, which then express more phosphorylated ribose and less phosphorylated p53. These Crohn's disease cells die less and undergo vigorous cellular respiration. When there are T cell abnormalities, it shows a sign of hyperactivity, meaning a loss of tolerance. Different T cell cycle characteristics leads to a pathogenesis of inflammatory bowel diseases. Karyotype. When there's an absence or dysfunction of the X chromosome, that greater the risk of the gastrointestinal disease such as Crohn's disease.
What is cervical cancer? So the cervix is the narrow part of the lower uterus and is often referred to as the neck of the womb. Cervical cancer affects the entrance to the uterus. So what causes cervical cancer? Most cervical cancers are caused by long-standing infections such as HPV. HPV stands for human papillomavirus infection and is the most common sexually transmitted disease. So treatment for cervical cancer include radiation therapy, chemotherapy, and targeted therapy, which targets the infected tissues. So the prognosis for cervical cancer is based on a 5-year survival rate, and the 5-year survival rate is based on the first 5 years after you are first diagnosed, and your survival rate depends on what stage your cancer is. So for example, if you're in your earlier stages, you have a higher chance of surviving, unlike being in your later stages where you have less of a chance of surviving.
So this is a diagram of the cell cycle, which consists of DNA synthesis, the cell growth, and again cell growth. It starts from G1 phase to S phase to G2 phase and M phase, which is also known as mitosis. In this case, G2 phase is what's going to be infected when it comes to cervical cancer.
So in the G2 phase, specifically at the G2 checkpoint, if HPV is present, or the human papillomavirus, the p53 protein is deactivated by the p53 inhibitor, and the p53 inhibitor is produced by HPV. So the blue kind of squiggly line represents the replicating DNA, and the blue squiggly line with the red line inside of it represents the mutation. So now with the p53 deactivated, the cervix cells with the mutated DNA successfully divide and multiply. So again, the blue squiggly line represents the replicating DNA, and the blue squiggly line with the red line inside of it represents the mutation. So now the mutated cervix cells grow uncontrollably and into a tumor. So as seen in the image here, for benign growth in cervical cancer, they are rarely a threat to life and don't invade the tissues around them, and they can consist of polyps and cysts, unlike malignant growths, where they can be a threat to life and can invade nearby tissues and organs and can spread to other parts of the body. So density-dependent inhibition is the process where crowded cells stop dividing, where the cells must compete for nutrients, space, and growth factors. So anchorage dependence is where the cells have to touch something in order to divide or they will die, and this relates with metastasizing.